Welcome to Dentistry Gone Wild, the official podcast for mobile and teledentistry. And I'm Sonya Dunbar, one of your hosts, and
I am the other co-host, Melissa Turner, aka Teledentistry Nerd. So we're just gonna get that out there up front.
Right.
And we are so excited. Today we're just gonna cut the banter and we're gonna go straight to our guest, because this is another fellow teledentistry nerd, and I'm placing that on him. So I hope that's okay, Dr. Suter, to say that. But we're excited today to have Dr. Nathan Suter here. He is a practicing dentist, a teledentistry enthusiast. That's a better word than nerd, I think. CEO of Access Teledentistry and co-founder of Healier. So we're going to dive into that. How are you doing today, Dr. Suter?
I'm doing great. Yeah, I'm. It's been. I think there's like a second wave of interest in teledentistry lately. I think through the winter time, and so I've been busy. Just educating people through Access Teledentistry on what kind of different ways people can use teledentistry, and to see public health and private practice dentists. I started my day in doing a webinar for the state of Washington's health centers, and I'll end my day with the Seattle King County private practice new dentist group. So kind of cool ends of the spectrum there as far as where people practice and the ways teledentistry are getting. They're asking about it. They're reaching out to me because people are just needing some resources. So it's been really fun sharing those things.
Yeah. And it is, you hit the nail on the head. It is cool to kind of see teledentistry was big a few years ago, just in the public health arena, right? And now it truly has spread its wings and has its feelers into every aspect of dentistry. So it's an amazing thing. Can you give us a little bit of information about Access Teledentistry? Is it a consulting business?
Sure, yeah. So Access Teledentistry is a consulting business that I started with the COO of Access Teledentistry is Tiffany Grant. She's a dental hygienist. And so her and I have been doing teledentistry together for, I don't know, maybe 4 or 5 years now. We started the first pilot in Missouri and at the health center that I worked at. And then at my private practice, and then Tiffany came to work at the private practice with me. And so we've worked really well together, and people just started asking, more and more people started asking, how do we do this? What do I need to know? What don't I know that I need to know? And so it turned out that the state of Missouri was our first, big client. The Department of Health there wanted us to teach other dentists in the state how to do teledentistry. And so from there, it's just grown into, health centers and group practices. And we just launched before COVID our first in-person workshop teaching people how to do teledentistry. And so we've done one of those, and we've kind of made a mini version that's online that we've been offering to people. So we can't wait to do those in-person ones with groups of maybe 30 to 100 people, because you really can get the energy and have that one-on-one and people work together, in small groups to kind of help plan how they're going to use teledentistry and share their tools that they've used. And those are kind of, those are the things that I get my energy, is helping people learn like that through Access Teledentistry.
I'm also looking at, and this is a big congratulations to you. I'm looking at a list of the top most influential leaders in teledentistry for 2020. And this is put out by the American Mobile and Teledentistry Alliance. And I see both you and Tiffany Grant made the list. So congratulations to you.
Congratulations
on that. That's huge.
Yeah.
Yes.
Thank you to you guys for including us in there amongst a lot of my peers that have been working hard to spread the word. And it's honored to be on the list amongst all those people.
So Doc, where Teledentistry, you, like you said, you and your buddy have been doing it for 5 years or so.
Yeah.
So it's not new to you or to people who have been involved in teledentistry, but to so many, it's new since COVID-19.
Mm-hmm.
So since it's so hot on the press now, where do you see teledentistry at in the next 5 years? What's new on the horizons for teledentistry?
I think that there's two parts to that. One, I think that teledentistry before COVID had about a decade worth of use, growing acceptance among in the public health space and mobile dentistry space. And so when it happened, people wanted to know about teledentistry, but a different kind of teledentistry. They wanted to know how to video chat with their patients, which is not how most mobile and telehealth, public health programs were set up over the decades. And so there's just kind of people that are new to teledentistry think of it as I'm Zoom calling with you, and they haven't even thought about the potential of how an asynchronous visit would really work in their practice. And so what I think going forward, what I keep talking to people about that really gets me excited is talking about how you might not have to see every single person in your practice for every single checkup if your state allows it. So in maybe 15 states or so, you can do an asynchronous checkup. A lot of practices have their days of their week that they're open are restricted to the dentist schedule. So you can open, having a well-calibrated dental hygienist team member, you can open up, have one late night a week where the doctor doesn't have to be there for your checkups. I think that part right there is what's going to make the explosion of growth happen, is where in a practice, doctors are using teledentistry every day, every week in different ways to help increase the amount of people that can come in the office, so the doctor can focus and not have to stop in a crown prep to do 3 hygiene checks. So
I hear doctors everywhere saying, "Oh, thank God."
Yeah, I mean, think about all the practices out there that got 3 up to 5, 6 maybe hygiene chairs going, and the doctors has treatment going. If you were able to put a system in place in your office where you could say, okay, whenever these patients getting checkups have these things, then I need to come see them. Otherwise, I'll review their record and they can go. They don't have to wait for me, and I'll just review the record. And so even if that's 30% of the people, those chairs are turning over faster because the doctor doesn't have to, you don't have to sit there and have that time where you're just waiting, twiddling your thumbs for the doctor. That room gets flipped, and then the next person gets called back, and you can get more people in throughout the day. And that patient just, didn't have 15, 20 minutes of their time wasted just waiting on the doctor to come in. So pretty potential, I think.
It is. And when you think about it, the way we do it right now without teledentistry is really inefficient. I mean, you could get up, like you said, 3 to 4 times, at least during one single procedure, to go do these hygiene checks, to go do these one-off post-op checks. And so what I hear you saying is, I know right now a lot of dentists have backlogs of hygiene recall patients. So could this potentially, this asynchronous hygiene checkup, could that potentially help with this backlog?
Oh, absolutely. We had a pretty big backlog, as you can imagine, at my office. And so with Tiffany and I, we did this. She stayed late a night a week, and we were able to do really good hygiene. My hygiene was up 25, 30%, the 2-3 months after, we got back to it. Now in my area, we kind of slowed down a little bit in the wintertime. People were canceling, they were leery to go out, but I predict the same thing is going to happen, as we ramp back up, going into the springtime, and people start getting the vaccine and people get more comfortable, and we want to get people to get back to health and maintain where they're at. So setting up a system where you can, see your hygiene checkup patients, and, the low risk patient, the stable adult recall patient, they're just coming in, they're getting their prophy, they're getting their fluoride, they're getting their x-rays and pictures done. In my office, we've started digitally scanning everyone. That is our data imaging that's our data capturing model, is we're capturing people on the new iTero that I got. And it's been a game changer. Like the predictability of that system, the quality of that system, and then she stores the data and she fills out a form in Healier and then shoots it over to me, and then I have all those patients queued up for me to review the next day when I get into the office. So I just get a little ping on my computer here at home saying I've got an exam to review tomorrow, and then I know when I get into the office tomorrow I'm doing treatment. And then I've got 8 to 10 patients to review their exams. It's pretty cool. It's pretty cool, predictable, and nice.
Yeah, and efficient. I mean, going back to that. Now, I know that asynchronous seems like a far-fetch for some practice owners because it may not be technically legal yet in their state, or the supervision laws may not allow it, that type of thing. So Dr. Suter, as you are interacting with your hygienists or even associates and other licensed providers for an asynchronous exam or evaluation of some sort, is there a trick to that? Is there a key to making that work well? Is it just a matter of calibration or communication? I mean, what have you found to be the trick to that?
It definitely creating a level of calibration and trust. So if you're going to start doing it with your hygienist, it's great if you've had working time with your hygienist in person, so that the hygienist and the doctor, definitely know how treatment, mantras are, and what constitutes, an intervention versus prevention and things like that. So as long as they're kind of calibrated on that, and then standardizing the amount of data that you need to complete the exam needs troubleshooted with the two individuals. Like, hey, I saw in this picture this doesn't work here. I need to see this or that. You didn't get back on the back of the molar. Here, let me help you. I noticed that was like 3 pictures that day. Maybe we could talk through that. How we're going to get that camera angle or the fog off of that. If you're doing that part of it, the data capturing part's been smoother now that I've been doing the scanning, because the technology tells the hygienist what's missed, which is really nice. And then having a standard set of questions that are answered. So that's what has made it a lot easier, is that having like a logic-based form, which is what we've been showing in the Healier, MVP, is essentially how you can take this set of questions and drill down whenever the answer goes a certain way. So if there's a symptom on this tooth, what's the symptom? And it's cold. Okay, how do they react to it? Like, drill down and answer those questions so that the doctor has this information. And so that's one of the things that I think always helps with the teledentistry, even a face-to-face one, is like, if I'm going to do a Zoom with the patient, I'm going to request information up front ahead of time, send a questionnaire to the patient so that I can review it before I get in the room, and then I can go into a Zoom call if I have to, ready to go. You don't have to pull that out of the patient through the Zoom call. And that's the difference between an 8-minute Zoom call and a 16-minute Zoom call is that. And so having consistent way of gathering the data, that what format it comes in, and what questions were asked and were missed. And so if a question was missed, your staff knows, oh, hey, he's got a Zoom call. I'm going to go and get that piece of data from that person if I can beforehand. And so that really makes it more predictable. And it's the same thing whenever the assistant goes and sits the patient down, asks a bunch of questions, and comes to you, and she knows what 3 things you want to know before you come back, So you need to have kind of a process built in for that. And I think that's the thing that matters the most. One of the things that matters the most, at least. Standardization, which is hard sometimes, but it's important.
Great news. Melissa and Sonya here to let you know that we've just opened up virtual tickets for Evolve 2021. The National Mobile and Teledentistry Conference is happening on March 4th through 6th in Orlando, Florida.
Included in your virtual tickets are over 2 days of events with more than 15 live educational hours and on-demand bonus content. You'll receive access to the virtual exhibit hall, special discounts, and admission to the hub, our new an exclusive online community.
That's right, it is. And as an extra bonus, this year we are super excited to announce that we've partnered with the brand new Denobi Awards, an industry-wide awards program to celebrate outstanding individuals in dentistry. The Red Carpet Awards Gala is taking place on the closing night of our conference on March 6th. Here's the thing, Sonya. If they buy a ticket to the conference, admission is included in that ticket.
Listen, if you bought your ticket, get your outfits together because this red carpet event is going to be amazing. So hurry and click the link below to reserve your seat for Evolve 2021.
We hope to see you there.
Bye.
Bye.
I mean, Sonya, you know this because you own a dental practice, but it's hard to find the time during the day, during the clinical day, to really work on that aspect of the business of standardization and efficiency. Sonya, you do teledentistry, don't you, right now?
Yes, we use Teledentix, and I really love the way that teledentistry makes the day flow smoothly, and it makes the doctor a lot happier. We had an emergency today in one of our nursing homes, and we were able, all of our nursing homes have the cameras now, and we were able to direct the nurse to do a teledentistry exam with the dentist and take the pictures, send it in. The dentist, we have already scheduled taking the patient off meds. We're already scheduled to go in 3 days to do the extraction. So that saved a lot of time. It saved legwork. It saved payroll. It's a more efficient way of doing dentistry. So Doc, we really appreciate you sharing this where people can see how you collaborate with your team, and especially the way you weaved in your hygienist and you've shown ways that you can use your hygienist to make it more efficient. And we really appreciate you sharing that with us, don't we, Melissa?
We do. Yeah, we really do, because I think that's the key to practices, successful practices in the future. It's really utilizing the team members and communicating and working together like that. So, Doc, you also have experience with both mobile and portable dentistry. Is that correct too?
Yeah. So at the health center, we had a mobile tractor trailer, a clinic and a tractor trailer unit that we would rotate around the community. And then it had 3 operatories in it. And then we had 3 portable vehicles that we used. They were for screening purposes. There was 2 vehicles that went and did screenings. And then when teledentistry, we kind of built the pieces knowing that the legislation I was advocating for finally got, passed. And once it was ready to go, we were ready to hit the ground running. So we got a grant to pilot the first pilot. And so we sent portable vans out. And that first year we saw 1,200 patients at schools and nursing homes. And we did asynchronous teledentistry visits is how we did it. Yeah, it was great. And I also am I've stayed in touch with the mobile teledentistry part of me. I'm on the board of a DSO enabled dental group. They do nursing homes and special needs homes and populations, serve those patients. They even go inside people's homes as well. And so still get to kind of, be in the mix with mobile dentistry and kind of see how hard it's been on them, with the pandemic, not being able to access some of their clientele.
Absolutely.
I in my gut, I'm feeling like, as we talk about this, as we sit here and talk about this, I'm feeling like we're just on this verge of seeing this huge spike in implementation of both teledentistry and mobile dentistry, soon. And not even just in the United States, but worldwide. Like it's been revving for a while. The information's been getting out there. People are curious, and then COVID happened, and now we're all getting back to normal. But I mean, just like you said, that DSO is now using it, and we're seeing others use it, and we're seeing some seed funding and angel investments going into these large organizations that want to provide mobile and or tele. And so I feel like we're just right there, ready to see it happen. And it's exciting.
Yeah. It's very exciting to see both of those things succeed. I think COVID definitely gave everybody a gut punch, but it really, accelerated certain things, years ahead in teledentistry. I think we're 3-4 years ahead at least in where people are comfortable with or what they're asking for now and purchasing and trying things out. And most people are starting with video conference still because it's just more natural to them. But I think, people started doing limited exams, and the thing that I thought was most exciting about it was they were doing limited exams, and then they realized how kind of once they could get in their office, there's really not a whole lot you can offer in that realm when you have an office, because in some ways you could just have them come in. But then like, I learned how to do this, but now I do all my post-ops this way. And I do all of my, like treatment plan. If someone wants to just review a treatment plan with me, I just jump on a Zoom call with them to review a treatment plan and say, yeah, here's the difference between a denture, a partial, and an implant denture. And they have a slideshow that you could show the patient right there. And you can even bring up their chart if you want to, and they get to stay at their home, and not have to drive in. So it's really kind of cool to see that that people came to it one way and they already started using it in other ways. And those other two ways, the consults and the follow-ups, the people don't even bill for those things. They realize that that's an efficient way to just do those processes of my office. Because whenever I would do my webinars at first, everyone's like, oh, how do I bill for this? And it's like, you're not going to find gold, doing, limited evaluations with your patients. But these very, forward thinking and savvy people that I've since followed up with and I've talked to, and they've reached out to me on webinars, are doing it for things they don't bill for, because they know that not everything's about what you bill for. It's just about efficiency, like there's something to be lot to be gained off of just being efficient and working smarter,
And
So-
not every one of those consults has to be, especially if it's not being billed for it. It doesn't always have to be with the dentist either. A hygienist, a reliable provider can hop on with the patient, and then the dentist is free to, to go about what he or she is doing. So one of the questions that Sonya and I get a lot, and I'm sure you could ask this too, is for the asynchronous exams, evaluations. What have you found to be the most efficient way to do those? Do you block off, your lunch hour every day? Do you do it in the beginning or end of your day? What do you do with that?
Yeah. So common question. Most of the time, people what I've been seeing is they hack their schedule to manage these things. Okay. And so they hack a schedule, which is synchronous, a synchronous tool for you to do an asynchronous visit. And so most people are like, the assessments today with the hygienist and dentist exam is tomorrow. They'll just take them and they'll put them at the end of the day or something as a little placeholder, and they'll just stack them up there. Or they'll pick a certain time of the day, like 2 days in advance, and they'll just park them there. And you hope that you get to them before then. Otherwise, the schedule keeps moving, and people can slip through the cracks, right? And so, so that's how organizing things, that's what most people go to at first. And then as far as finding the time, it just depends on the volume. Like when in my office, I might have, 8 to 10 in a day. That's at most, maybe from a 1 day previous. And so those I can usually work through, throughout my day. I'll just grab a couple, because I'm not having to have a conversation really with the patient. So the checkups usually take less time. And so I'll do them throughout the day. I'll do a few of them, and then I'll do a few of them maybe over lunchtime, and then I'll do some at the end of the day. But most states, it's about a 48-hour window to finish those up.
Awesome. Yeah. So what about the the synchronous portion, the live?
Yeah. So
video
I carve out 4 spots in my schedule each day, where it fits between like flipping rooms, so I'll just have a blocked part that can be scheduled with a synchronous Zoom call or whatever. I use Zoom right now. I do. And so those I usually have just 4 of those a day. And so they can be booked online, or someone can call and my front office staff can schedule on those spots. Or sometimes I'll check someone out. Like I had a patient who had TMJ pain, and I made her a splint. And so I wanted to just follow up with her in 2 weeks. And so I just said, hey, just grab a Zoom spot on my calendar and I'll just check in with you then. And I make a virtual column. So sorry, I usually do that. I usually make a virtual column for like a virtual operatory, essentially to hold those
That's nice.
visits. So
That's a good idea.
Yeah, I make a virtual operatory for my synchronous visits, and then I have like, most PMSs have like a perfect day schedule kind of tool to kind of put those in, and then the asynchronous visits I've migrated to Healier, which I've co-founded, which is essentially a task management system to manage the queue of patients I have to review, and then we hand off our patient. I hand off the patient virtually to the next person to handle the next thing with them. So patient will get seen, get assessed. She fills out a form. It populates in my queue. I review the patient information, and then I open them in my dental record. I do the exam, and then I usually have different statuses that I put the patient in. So I'll say this patient either needs treatment, or they need to go on recall, or they need to go to referral, or they need to go, maybe I need to do a follow-up consult call with them. And so I'll just drag it. And then my treatment coordinator is in charge of contacting the patients and figuring out, getting the next step scheduled with them.
Mm-hmm.
Yeah.
Sonya and I are really excited about that. And we had the chance to check it out the other day, and it looks, once you see what you were just explaining, it's like, oh yeah, this is missing in the teledentistry flow in any dental practice. So thank you for being innovative in that. Yeah. Sonya, it's time to wrap. What else do you have to say, Sonya?
Nothing. Doc, are you going to be at the conference this year?
I'm planning on doing the virtual version. So as long as I can, I've got a couple things going on, but I am coming to the virtual version. As far as the in-person, one day.
Right.
One day.
You're going to be tucking in those synchronous encounters between courses, aren't you?
Yes, exactly. Yep.
Great, Doc. We are so glad that you joined us on our show today, and you gave dentists a bird's eye view into a virtual teledentistry schedule and into how they can incorporate teledentistry just with Zoom in their practice and make it more productive. So thank you for sharing your wisdom. We always love having people who think outside of the box, and someone has been so embedded in teledentistry on our platform. Thank you so much.
Thanks for having me.
All right. So that's a wrap. And we cannot wait to see you at the upcoming National Mobile and Teledentistry Conference coming up on March 4 through 6. And it is coming up soon. And we are so excited. We're also excited to see you at the Denobi Awards. Right, Sonya? Absolutely. It's a red carpet event and you don't want to miss it. We are highlighting the best of the best, the cream of the crop, the top notch in dentistry. This is going to be amazing. You do not want to miss this event. That's right. Don't forget to like and share this podcast and tell your friends about it. And we will see you next Monday. Bye now. Bye.
Thank you for listening to Dentistry Gone Wild, the official podcast for mobile and teledentistry. You can subscribe to our channel wherever you listen to your podcast. And if you're enjoying the show, please leave us a review.